20th meeting. Any additions, deletions, or corrections? Hearing none, all in favor of the motion, please indicate by saying aye.
Aye.
Opposed, same sign, so moved. Now we'll go to the warden's report and any other reports from other members of your cabinet.
Good morning. Today we're running a job fair at the facility from 9 to 4. We've had about 10 people interviewed so far this morning, so that's good. We just completed an academy class of 4 full-time officers, and if everybody gets approved at the commissioners meeting tomorrow, we should be moving forward with another 16 employees for the correctional facility.
Would you say those numbers individually?
Yes, so 4 that should be completing the current academy. That would be 3 males and 1 female. If all 16 names get approved at the commissioners meeting.
That was the one I'm having trouble with. 1 6 or 6?
4 full-time staff,
Yeah,
3 males and 1 female.
okay.
We present 16 names to the
That
commissioners.
was the number I need.
16 names for tomorrow's
Not
meeting.
6, but 16.
Yes.
1 6. That's what I was trying to get
I'm
at.
sorry, yes.
Yeah,
16
okay.
names tomorrow, which out of that we're hoping to get 11 full-time males, 2 full-time females, and 3 part-time males. So we're seeing some movement, so I'm thanking everybody for their involvement in that process to get us to that point.
Wow.
We also just celebrated National Correctional Officers Week. That was May 1st to May 7th. And I just want to take another opportunity to thank the staff that we have that stayed committed and are coming into the industry in the correctional field, because it's not easy work, but they're much appreciated.
Fantastic. Yeah, numbers, I tried, they went dead. I charge them at night and they're dead in the morning. So anyhow, I apologize, but I wanted to get that number correct. Thank you.
Yeah, sorry, I wasn't comprehending.
That's all right.
You know, making the assumption that all that gets approved in these 2 positions you just mentioned, what will be the need, you think, for working double shifts? Is that going to go down drastically? Reduce it by half? Reduce it a little bit?
I feel like we should see a reduction based off the numbers towards July, August, because we're running a 5-week training academy. So the classes that have gone through so far have run through a 2-week Department of Corrections Academy, and then we pull those individuals back within 6 months to meet the training requirement for the Department of Corrections. This next academy, because it's 16 people, we're going to run a full 5-week Department of Corrections training academy, because we want to make sure that they're getting fully trained, and now we have a little bit of a movement at that. Part of the contract settlement with the arbitration was also that we're not mandatorying new employees for the first 30 days of their employment. So once they get out of the academy, which takes about, like I said, 5 weeks, then there's 30 days on top of that. So I would think by like August, we should start seeing a drastic reduction on the numbers. The population is also maintaining around 260. So with those numbers, that's a huge help. So I do feel like you'll see a reduction in mandatories no later than July, knock on wood. Every candidate that comes to the academy, we try and train, but as we all know, not everybody's a good fit, especially in the field of corrections. So we have to, keep an eye on that. But we're hoping to see a drastic reduction by July, August.
Great, thank you.
Thank you.
Fabulous.
Anything else, Warden?
I know.
Tom, do you have anything for the enlightenment of for us, with regard to your end?
Nothing formal. As we discussed briefly before the meeting, company-wide, we are starting to see an increase again in COVID cases, unfortunately. We're doing a good job in Lebanon right now. We had 2 positives in April. We have 2 quarantine units right now. 1 should be coming off shortly. So we're still playing it day to day in terms of opening back up for programming. One thing I would like to mention, I'm not sure if the commissioners are aware, but the U.S. Department of Justice sued the Pennsylvania judiciary system over certain restrictions they have on medicated assisted treatment in some counties, where that is being viewed as a burden for individuals who want to get into certain programs. In the 6 states we operate, 2 of them now have legislation that mandate medicated assisted treatment in county facilities. Pennsylvania is not one of them yet, but reading the tea leaves, it looks like all counties will be moving in that direction. So we just unveiled, and I'll be providing to the warden here after this meeting, a new policy on MAT, so that we're prepared for when Lebanon County needs to or elects to offer that programming in the facility. From our meeting this morning, learned that we're having a number of individuals becoming incarcerated who are participating out in the community in a medicated assisted treatment. So it could be beneficial if we have the ability to maintain them while they're in there to maintain their sobriety.
Do people still lose their medical coverage when they enter the facility and it becomes a burden? I say a burden on all the taxpayers.
Yes.
That's a sad thing. Okay.
Yeah. I mean, unfortunately, many of the individuals that require most of our care are uninsured in the community to begin with.
But there are those that were working and they lose
yes,
their insurance.
they lose their insurance.
Yeah.
Yeah. Little known fact to many.
Yeah. Okay.
Okay.
Things change. That's why I asked.
Yeah.
Anything else?
Just this medically assisted treatment. You mentioned in your statement sobriety. Is this just for folks with substance addiction disorder?
Yes, you need to have a DSM-5 substance use disorder diagnosis in order to qualify for the MAT treatment.
Okay.
But it is not limited to opioid. I mean, you can also have alcohol, dependence as well that can be addressed.
Because other, the regular medical needs that a person has, high blood pressure and diabetes, I mean, you're obligated to provide them medicine for that.
Correct. Yes, and that's the new school of thought is, since it's a DSM-5 diagnosis, it should not be treated any different than diabetes or high blood pressure. It's a medical condition now recognized where 5-10 years ago that wasn't necessarily universally adopted.
And I did want to ask, and I'm glad you mentioned sadly, the increase in COVID cases that we're starting to see again, and how this plays into thoughts about, are we ever going to reestablish work release? I understand, we're living in this time where we're all just sort of now living with COVID, and you might get it, but hopefully it won't be severe if you do. And I mean, how do you address that as the warden?
I address it networking with the courts, Judge Towak, and with Prime Care, trying to follow the best medical practice advice, but also meeting with the courts and figuring out if there's a way, as we continue to staff appropriately, what that might look like. So we're continuing evaluating, we're looking what other facilities are doing and seeing, if there's a way we can make this work. Our goal at the end is to have an active work release program. Nobody likes the fact that we're not able to do that right now, but we're always trying to find a way to get there.
Is it legal or illegal to require that if they go on work release, they have full vaccinations so that there's a less chance of them bringing it into the facility? Is that something we can do or not?
I think that's something that's up for the solicitor. In talking with the court, we had several conversations. Some prisons have been requiring it because work release is a privilege, but then there's been some schools of thought concerning reasons why people choose not to get vaccinated. So again, that would be something the solicitor would have to sign off on, obviously the prison board and you as commissioners with what's comfortable language to proceed in that direction if and when we can get to that point.
I was just trying to find the happy medium because I know if they go out and they can bring it back.
Sure. I think there is a justifiable position to require vaccination if you're going to go out, but I believe that requirement requires an exception for a health-based denial of the vaccination.
So there are other facilities that are either reestablishing or have been continuing with work release.
Yes. What other facilities have the advantage of that we don't at the Lebanon County Correctional Facilities, they have off-site work release programs. So when you have an off-site work release program that's not attached and you don't have to share general population housing with the work release individuals, that provides a different kind of barrier to with the spread and that kind of stuff. So that's the main concern. If we're sending people out and they're coming back in, what serves the greater good? Where's the greater purpose served?
Okay, thank you. Jamie?
Since you started, 2 members of the public came in, and last month, one of the topics during public comment was the contract with the union and the vacancies and so on. So would it be okay?
That we weren't doing anything, I don't want to
Would it
revisit
be
that.
okay for the warden to repeat what,
Yeah.
what she said in the beginning
That's
about
fine.
the
That's fine.
billing? Yeah.
Yes, we have full-time staff going through the training academy currently. That would be 3 males and 1 female. At the commissioners meeting tomorrow, we had submitted for potential approvement of 16 additional staff, which would be 11 full-time males, 2 full-time females, and 3 part-time males. So my math is not wonderful, but about 20, we're looking at probably having about 20 new hires successfully completed in training, and if everything goes well, by the end of June, early July.
Okay.
That's increasing the total complement by about 25 to 30%, I think. If, you know, all of those
Hopefully that'll
hires
abate some of the,
stick around.
yeah.
Yep.
Yeah, we do have I do know that we do have another retirement that we'll be talking and presenting next month, prison board. But we did lose a couple for retirement or resignations in between the process. But the numbers are really good for us and the community and the facility that we're seeing apply and come through
Hopeful
now.
signs there,
Yes.
yep, yep.
Any rehires? Last month, I think when Michelle presented it, there were 2 rehires.
Yes. So when we look at, rehires, we evaluate the reasons why they, A, departed in the first place. Number 2, if they followed proper procedure as far as departure, if they gave a proper 2-week notice, and if they left on good terms, I have no issue rehiring them as long as they're meeting the qualifications and they can get through the standard of training that we require.
Oh, so would they would have to go through the academy again?
Yes.
Oh, okay.
Yes. Yes.
Anything from the board? All right, motion to adjourn.
So moved.
We stand adjourned. Thank you for your attendance.
Thank you.
Thanks for the good news.
Thank you.